Hello, everyone. We're Chase Driver and Daniel Poole, and this is our Milestone 4 final research video presentation. As part of the University of North Georgia's semester-long innovation challenge, we've spent the past several weeks conducting an in-depth investigation into some of the most devastating issues affecting the North Georgia region. The primary problem we would like to discuss today is drug overdose deaths. Our research has identified drug overdose deaths as a central urgent problem in the North Georgia region. This is especially true in rural and underserved communities. This isn't just a crisis, it's a cascading public health emergency rooted in systematic gaps made worse by overlapping socioeconomic and healthcare barriers. Today, we'll explore the three most impactful contributing factors behind these overdose deaths in the region. They are the lack of treatment facilities, economic instability and unemployment, and the opioid crisis. The first major factor contributing to drug overdose deaths in North Georgia is economic instability and chronic unemployment. Many parts of this region were historically reliant on agriculture, textiles, mining, or the manufacturing industries that have declined over the past several decades. This has left a vacuum of economic opportunities in towns like Blue Ridge, Ellijay, and Dahlonega. This is especially true for the younger generations. According to the U.S. Census Bureau, nearly 1 in 5 households in the Appalachian counties of Georgia live below the poverty line. These communities face limited access to education, transportation, broadband internet, and affordable housing, which all contribute to the lack of social mobility. Unemployment and underemployment do more than hurt wallets. They create chronic stress, hopelessness, and emotional isolation, all of which are factors for substance use disorders. The Center for Disease Control Prevention has shown a strong correlation between economic distress and overdose mortality, particularly in rural areas with high unemployment and low access to healthcare services. In some communities, drug use becomes normalized as a coping mechanism for financial instability, trauma, and limited prospects. Moreover, when individuals lose access to employer sponsored insurance or Medicaid due to job loss, their ability to pay for mental health or addiction services disappears entirely. Improving economic conditions would offer individuals more than just income. It would provide purpose, social connection, and stake in their community's success. A stable job is often one of the most potent forms of relapse prevention. Addressing economic hardship as a health deterrent would create a ripple effect, reducing drug related deaths while building a stronger, more resilient North Georgia.
The second of the most significant drivers of drug overdose deaths in North Georgia is the overwhelming lack of accessible and adequate treatment facilities. Many counties in the region, including Union, Fannin, Gilmer, and Lumpkin, do not have a single inpatient detox or long-term rehab facility. Individuals suffering from substance use disorders are often left with no choice but to travel long distances, sometimes over an hour, to receive care, assuming they can even get placement. So, according to the Substance Abuse and Mental Health Services Administration, fewer than 25% of counties in Georgia have certified substance abuse treatment centers. This means most rural residents, including those in North Georgia, lack access to structured, evidence based recovery programs. These gaps are compounded by a shortage of outpatient services, detox programs, medication assisted treatment, and mental health counselors who specialize in addiction. In practical terms, the absence of treatment options creates a vicious cycle. Without access to professional health, many individuals either continue using or attempt to quit on their own, often unsuccessfully. Relapses are common, and each relapse increases the likelihood of an overdose. The Georgia Department of Public Health reports that over 60% of overdose victims in the state had no prior documented attempt at receiving addiction treatment. Hospitals and emergency departments are often overwhelmed and unequipped to offer long term care solutions. Instead of recovery, patients are stabilized and discharged, only to return to a crisis. Law enforcement, too, is forced to act as a frontline responder to addiction without the training or resources to intervene effectively. Addressing the treatment gap would save lives and reduce the long term strain on Georgia's healthcare and criminal justice systems. It would give individuals a real chance of recovery, reuniting families, revitalizing communities, and restoring hope in some of the state's most underserved regions. Lastly, and at the heart of the drug overdose epidemic, is the opioid crisis, which remains the single most significant contributing factor to overdose deaths in North Georgia and across the United States. What began in the 1990s with the overprescription of drugs like Oxycontin has evolved into a crisis dominated by synthetic opioids such as fentanyl, many times more potent and deadly. Our aim is to ask the question: how can the Internet of Things reduce the rise of opioid-related deaths in North Georgia? The Internet of Things refers to a growing network of interconnected devices equipped with sensors, software, and connectivity that allow them to collect and exchange data. While IoT has transformed sectors such as agriculture, transportation, and energy, its most promising applications lie in public health and emergency response. Smart cities integrate IoT technology into public systems and urban planning to deliver real-time data insights, improve infrastructure, and enhance quality of life. Cities worldwide already use IoT systems to tackle high-stakes, hyperlocal problems, from managing traffic congestion and waste to addressing behavioral and mental health. Could the democratization of innovation put the power of innovation back in the hands of North Georgia citizens through rapidly evolving technology? We reviewed global case studies of IoT deployments in public health to explore how innovative city concepts might be applied in this context. These examples demonstrate how other regions are successfully leveraging technology to identify, prevent, and respond to substance use and drug overdose deaths. These initiatives vary in cost and scope, such as Amsterdam's wearable program. This program costs approximately $200 to $350 per user annually. Baltimore has introduced naloxone stations that cost around $2,500 to install, with $500 in annual maintenance. Larger platforms like those in Columbus and Chicago require up to $1 million in investments. Regardless of scale, these programs demonstrate positive returns by reducing emergency response costs, improving care access, and most importantly, saving lives. Between 2019 and 2021, opioid-related deaths in Georgia increased 201%, while deaths involving fentanyl rose by a staggering 232%, according to the Georgia Department of Public Health. Fentanyl is now present in nearly 75% of all overdose deaths in the state, and it's increasingly being mixed into heroin, cocaine, methamphetamine, and counterfeit pills, often without the user's knowledge. In North Georgia, the problem is especially acute. For example, Lumpkin County reported an opioid overdose death rate of 36.4 per 100,000 residents, which is well above the state average of 24.7. Meanwhile, emergency room visits for opioid overdoses in rural counties like Gilmer and Fannin have risen by more than 70% in just 2 years, according to the CDC. The unintentional nature of many overdoses compounds the crisis. People are dying not because they're consuming large quantity of drugs, but because even a tiny amount of fentanyl, just 2 milligrams, can be fatal. This has led to a dramatic increase in first-time or occasional users dying from accidental overdoses. Mental health also plays a key role. Georgia ranks 47th in the nation for access to mental health care, according to Mental Health America. And untreated mental illness significantly increases the likelihood of opioid addiction. Anxiety, depression, PTSD, and trauma are all common among those who use opioids to self-medicate. First responders are doing all they can, but even they are stretched thin. Only 60% of rural emergency vehicles in Georgia carry naloxone, the life-saving drug that can reverse opioid overdoses if administered in time, according to the Georgia EMS Association. The human cost is staggering. Families are torn apart. communities are destabilized and employers face shrinking workforces. Every overdose has a ripple effect through the community, affecting schools, churches, workplaces, and civic institutions. Solving the opioid crisis would bring transformative change to North Georgia. It would save lives and restore rural towns' vitality, lower healthcare and justice systems costs, and help break the cycle of poverty and trauma that have persisted for generations. The region values every life and is committed to building a future of recovery, opportunity, and resilience. Drug overdose deaths in North Georgia are more than a tragic statistic. They're a public health emergency that threatens the future of entire communities. By identifying the lack of treatment facilities, economic instability, and especially the opioid epidemic as the most urgent drivers, we are shining a light on the most critical areas for innovation and systemic change. So as we continue this project, our focus will remain on solving the opioid crisis, which will be the central pillar of our intervention. By understanding these challenges at a deeper level, we can develop solutions that are effective, that are equitable, and that are sustainable for the people of North Georgia.